Welcome back to another episode of Sports Medicine on Tap. My name is Brandon Align. I'm sitting here at a full table with my good friend Dr. Frey at Neck of the Woods Brewing Company.
Yeah.
Dr. Frey, good evening. How are you?
Good evening, man. Yeah, we're kind of between seasons here.
Yeah.
Soccer came to a close. Basketball hasn't really started our ramp up yet, but we've got a few people here. It's nice.
Yeah, it's decent Tuesday night at Neck of the Woods. Nothing crazy, not too busy, but good crowd. And we have a full table tonight.
Yeah.
With people and props, banners.
Yeah.
And I think
Flights.
this might be a show first that we have a guest get a flight.
Yeah.
Not that it's a bad thing.
Yeah.
I think it's great.
Top quality right there.
So we'd like to introduce
High level move.
Kevin Gehsmann from Protect3D, a 3D printing durable medical equipment company.
Right.
Has come on to join us and to talk about your company, your equipment, your story, and all this other great stuff.
Sort of game-changing concept, if you ask me. Yeah.
Oh, yeah.
It's going to be pretty special. Can you tell us first a little bit about yourself, and then we'll find out a little more about what Protect3D does.
Absolutely. Thank you for having me, first and foremost.
Sure.
So my name is Kevin Gehsmann from Greensboro, North Carolina. I played football at Duke University.
Okay.
Not a bad start.
Studied mechanical engineering and ultimately started this company out of the intersection of the two, working hand in hand with our athletic trainers, making custom bracing, and being at Duke had some doors open for us to start the company straight out of school.
That's kind of awesome.
I know.
What a setup, right?
Yeah, I'm jealous, man. I was like, when do you graduate, man? 2019. 2019 already got something pretty good rolling. Yeah. Not too bad at all. Right place, right time. Doing the right thing, capitalizing. So what exactly what exactly does Protect3D do, and generally how have you made things a little bit better than the way they've been?
So Protect3D provides custom bracing to athletic trainers and sports medicine professionals across the country now.
Right.
We use 3D technology, starting with our iPhone app to take a 3D scan of patient athlete anatomy, gets uploaded to us through the cloud. Our team of design engineers custom fabricates the product, and we 3D print everything in-house to ship all across the country.
Yeah.
They are delivered in as little as 48 hours to get athletes back in the game that same week to play healthy.
It's better than Amazon Prime. It's Protect3D Prime right there.
Right, next level. Seriously.
Yeah, it's seriously next level. And as an athletic trainer, time is of the essence, right? When you have something happen like that, especially with football season, you only have 1 week or so, or a couple days to go within between game to game, and then let alone something happens during the heavier days in the midweek practices, and something you need something like that to happen.
Yeah.
You contact our good friends at Protect3D, and you kind of get your stuff pretty quick.
It's not so. Actually, the timing of this is pretty amazing, and it just always seems to work out this way. There's another podcast out there, Mike Reinold. He's a physical therapist, and it's a good podcast. It's a sports medicine podcast, and as luck would have it, he had a guest on episode 41, 42, I don't know. So not that long ago, his guest was a guy named Scott Greenberg. It's just small world kind of stuff. Scott Greenberg, we grew up together, elementary school, junior high, high school, graduated together. I was at his wedding. We wrestled together. A good friend of mine. Sort of lost touch a little bit. We're not, we don't talk as frequently, but still, growing up, great friend of mine. The reason I bring up Scott Greenberg is he's now a physical therapist at the Gainesville, University of Florida.
Okay.
And in the episode that he was on with Mike Reinold, he got into talking about how did he sort of establish himself in this world, and part of it was he was making different prosthesis. And it's a little bit different. He's kind of found his niche and his specialty in foot and ankle, and he was so he talks about 2 hours for each one, grinding them, putting them together, shaping them, fitting them, taking them back, doing the next one. And he said, he'd go in Saturday mornings, 5 a.m., and spend all day on his day off and make all of these things. And this is as a physical therapist, not as an athletic trainer. And he said, I don't really do it that way anymore. It's just too cumbersome. It just takes too much time. And sure enough, me listening to that podcast and listening to my buddy talk about all this stuff coincides with you coming on to talk about this and just what it can do for the very busy athletic trainer or the very busy athletic department that doesn't necessarily have time to put all of this stuff together. Can you show us a little bit about, show us some of the stuff that we have here?
Absolutely, and that's exactly what it is. We've created this solution to fit the fast-paced athletic training room, and I think our experience playing really just puts that in perspective. We know what the setting is. We know exactly how it needs to work. It needs to save time, not make more
Right.
time in your day. So we have a face mask here. This is a custom fabricated device to obviously fit the 3D scanned facial anatomy, and this one is lofted off of the nose. Actually fits my face.
Right.
But you've seen these across the NBA now.
Right.
In the collegiate and professional sports setting.
And you guys are putting these on NBA players already, right? Like, we can't talk about who's getting and who's wearing, but you guys are putting these on NBA players already.
That's correct. So their sports medicine staff uses our app, takes a 3D scan of the anatomy. One team last year took the 3D scan on an away trip, and 2 days later, the device is sitting at the hotel lobby front desk on another away trip. So
Right.
that turnaround for an elite athlete to get back on the court 2 nights later.
Right, right.
And that's huge timeline wise, right? Like, because I mean, they sell the classic face guards that you all see, but I haven't seen a professional athlete or high level collegiate athlete ever wear one of those. It's always something custom made or whatever the case is, and to
Right.
have it a quick turnaround time is a game changer.
And a big part of it is like it has to be, especially for an athlete, like very well tailored. It has to be this custom fit. All of a sudden you start losing some visualization, little blind spots, and that's a big problem for an athlete.
We see a lot of the off-the-shelf products we say is one size fits none.
Yeah, no, I agree. I definitely have seen that in my practice of just like, this kind of fits, but it's really annoying.
Just doing
and
the best you can.
You're doing the best with what you got, right?
And then, and truth be told, right, it really does need to fit fairly well for it to serve its purpose. Like,
Correct.
I think there's a lot of logic that goes into how this works, right? If you're trying to protect your nasal bone, you want the pressure to be more here. You want that to be off. That needs to be recessed off of your nose. And same thing, maybe if there's a fracture, orbital fracture underneath, like you need to have that part a little more recessed. And off the shelf doesn't necessarily take that into account.
Right.
But if you're doing the scan, which are, hopefully we get to take a look at, and then you incorporate where the fracture is. If you have that additional information, are you able to build it as such to avoid that particular area, to really customize it for that person and that fracture?
Absolutely. That's exactly what we take pride in, is understanding the ins and outs of the use case in order to do that. We collaborate with a craniomaxillofacial trauma surgeon out of Duke Health, Dr. Powers, and he's helped us really create the baseline products for the nasal fracture and orbital fractures. So when possible, when we're dealing with an orbital fracture, we actually take a look at 3D CT imagery to identify the exact fracture site. Then when we get the 3D scan, we can translate the 3D CT onto the external scanned anatomy, locate the exact sites where we need to offload the mask.
Right. I mean, so again, next level, right?
Yeah.
Like it's not just a custom fit, but it's also custom fit for that particular fracture.
Right.
Where are we going to recess it? Where are we going to, you want the protection, you want the pressure to be on either side of the injury, not directly on the injury, right? So that's how you're protecting the area that got injured.
Right.
It's pretty amazing. And
Yeah.
in all honesty, I cannot see a scenario in which this doesn't start to become how pretty much all of these types of things are handled or treated.
We're starting to see that really in the collegiate and professional space, and it's inspiring to say the least on our part. Like starting as athletes, seeing the athletic trainers that were my athletic trainers use it, of course.
Yeah.
But now, just as the athletic training community is so tight knit, it really just spreads from one person hearing, hey, what'd you do? How'd you treat this? Well, we used this 3D technology solution.
Right.
Speaking of tight knit athletic training community, you guys work with Charlotte FC a little bit, right?
We do.
Not mentioning specifics of anybody. So you're familiar, you're friends with Tyler Knight, or at least you know Tyler Knight.
We've worked with Tyler Knight a number of times.
Yeah. Wonderful guy, man.
Good guy. And then, to keep on the MLS train, FC Cincinnati
They just beat
us up pretty good in the Philly area.
Right. They're a good team, man.
Our guy Scott Armistead up there is doing pretty good at what he's doing, and
smiling, laughing.
Yeah.
Whatever. Congratulations.
Congratulations to Cincinnati for sure.
Yeah.
But yeah, like you said, I mean, we just talked pre-show. I mean, he was working with one of my former, not college roommate, but one of my postgraduate roommates.
Yeah.
And he's making splints for him too, and it's like, wow, everyone kind of knows a little bit of everybody, and we all know each other.
It's truly amazing, spectacular.
And it's funny to go back to that, right? Like I was telling you before. My friend and I, we worked together down in Baltimore, and at the time, I thought of this the other night after we did our demo online. We had someone come in for 3D printed orthotics for feet,
Right.
And this is back in like 2015, right? And so they had this big thing, and they showed us that you would walk on a force plate or whatever, and they get your scan, and they would send it off. They would send it all the way off to Germany because at the time, U.S. didn't have the 3D printing technology or whatever, and it would take however much time it took to get to Germany and to get back. So you're talking like a couple weeks just for foot orthotics.
Right.
And now, 2023, we're here, and we're talking 48-hour turnaround time.
Right.
Which is just crazy how evolution, how things just change in the world of sports medicine.
I don't think foot orthotics is really one of your main products, right? Like show us a little bit about some of the things that you brought here with us and some of the products that tend to be more of your workhorses.
Yeah, so holding here, this is an upper extremity device. So this is splinting a scaphoid fracture. This would be the gameplay device. So you can see it splints the whole hand and wrist, and then has the thumb spica involved. So if it is on the radial side, you're going to splint the thumb too.
Sure. How does this sandwich get held together?
So it's a bivalved gameplay cast. It will be taped over top, some foam padding on the outside as well.
Right.
But we'll totally stabilize the anatomy. And what we like to say at our company is we're providing the right level of immobilization, but in a functional way.
Right.
Again, as former athletes, we know what you need to play at a high level, and we want all of our devices to be that functional immobilization.
So you guys have a testimonial on YouTube where with one of the Duke swimmers who also had scaphoid fracture, and so in that version of this splint, is that where we're going to next?
Look at that.
It is.
As luck would have it.
This would be like a short arm cast, so a true casting replacement. It's open cell,
Right.
and breathable, comfortable casting replacement. So fully waterproof.
Thus it works in the water.
And bivalved again, and has a tabulated system that allows a little bit of swelling throughout the recovery process as well. It's a great product. In the athletic training room, especially when you're seeing day-to-day care and able to take a cast like that on and off, provide the level of treatment that you want to, is I think a game changer.
Right. And this is not just doing your best to mold it to a specific injury, but this is actually created specifically with that person's or that patient's anatomy. Like that's how it is actually created. Like when you mold it and you have something that's flexible and moldable, it's helpful, but it's actually probably not quite as well contoured, is my guess.
That's a great point. Yeah, we're creating not only like patient-specific products, but pathology-specific solutions with the individual in mind. So position-specific products. We hear about like the position-specific helmets in the NFL protecting the quarterback from the hits they're going to take. Well, we make an AC pad as another common product, and now we have the basketball version of an AC pad. So it's slimmer than what a running back needs, slimmer than what a linebacker might need.
So do you change up the material that you're using depending on the injury or the use then in the sport?
In the like digital world, we have abilities to toggle several different things. In the 3D printing wise, we can change material from product to product to splint and immobilize certain anatomy to be optimal for bending and springing back, or for like impact absorption. Those are kind of the primary three. We're able to do like varying thickness when you're hand molding orthoplastic.
Pretty standard, right?
The days old way.
Right.
You're constrained to that uniform thickness, which is always going to be bulky. And people are darn good at it.
Yeah. Right. It is an art, without question. It is an art.
So we like to say we're not taking away the arts and crafts that go there, but we're elevating it. We want to be collaborating with the medical staff to create the best possible solution.
Yeah, because I think it's like 6-in-1. Like it's a happy medium, right? Because like I do love playing with orthoplastic work. Like it's like I was like, oh, I get to take like an hour. Like I'm going to do arts and crafts. I'm just going to go do my thing.
Arts and crafts.
But you know, I can get it done within like a day or so, give or take. But like, it's not going to be 100% custom fitted to their like something like this. Yeah, you give me a couple days, I can make something close.
Right.
But it's not going to fit and have like clip in real nice and sit so perfectly.
Right.
It's just the ease of it and the functionality of it. It's just that's the biggest game changer.
To talk to it again, it's anatomical precision to within a millimeter.
Right.
To within a millimeter. It's not too bad.
And I couldn't tell you how close anatomically correct the orthoplast I make is.
Probably not within a millimeter.
0% chance it's within a millimeter.
And then from the viewpoint of like institutional level, the institution has we have 7 athletic trainers on staff. I'm making that up, right? Like if one of those athletic trainers is off spending 4 hours making 2 splints, that means they only have 6 athletic trainers on staff for that period of time. From an institutional level, it is a good idea to be able to just outsource this. You get it in, you get it probably more quickly, and like you said, it fits exceedingly well, on an anatomic level.
That's exactly right.
So I think we could walk through the process, right? Like we're talking about how it goes. So let's just arbitrarily, we can talk about any of the devices here. Like we can talk about the ease of like access of how we have an injury. We'll just we'll go with hand, I guess, because it's easier if we need to scan anything.
For sure.
Hand injury, we have the person. So you can make a thumb spica or a pad,
right?
You know, like we said, a couple hours with some fine tuning or whatever. So can you walk us through like the process on your end, how we would, as an athletic training sports medicine staff, do the same approach without actually molding all the orthoplasts yourself, like the scanning time and all that stuff?
Yes, absolutely. So you open our app, you're met with a portfolio of products. So it looks like you're choosing from some products. Those are the starting point of use cases we've seen before. And now that we've taken care of 100 or a couple hundred thumb injuries over the few years we've been in business, we have the variations that are most common to protect football players, whatever sport you're dealing with. And there's probably a good starting point in there. So you select the product you want. It walks you through how to take the 3D scan for the specific device you're going to be ordering. And it's like taking a video with your smartphone. So it's not like traditional medical imaging if you need an x-ray, you need these complex things. You do it on an iPhone. It's the same scanning technology that does biometric Face ID on your iPhone. We're capturing
super accurate.
We're capturing anatomical data with that. You're navigating around the anatomy with your phone that picks up the area that we're trying to custom fabricate the device to. You press done, just like you're ending a video, that gets uploaded to us. So we're going to give a thumbs up on scan success, and it goes to our engineering design team.
And this is HIPAA HIPAA approved, right? Like this is the whole process, the app. It's again, now you're dealing with some medical stuff, right? It's all HIPAA.
Correct. Everything we collect is de-identified 3D scan anatomical data. And our engagements with the teams and sports medicine departments we engage with, take that to serious consideration.
Yeah.
Is there any way we can get you to do a scan? I don't know how quick or how long. Just kind of get curious on how that would go.
Absolutely. So again, I have like the video looking process up here. I have Dr. Frey's hand and wrist thumb area in the green, and I'm going to press go. And now we're capturing 3D data. And I'm navigating the phone around the anatomy, keeping the thumb, hand, wrist at the same distance away from my phone with the camera pointed towards it. And about 20, 30 seconds there.
There it is. That quick.
We have a 3D scan of at least the dorsal side of the thumb. So we could fabricate a device to that part of the scan.
Show the camera, just so that YouTube got that is.
You can see
is
there.
Is it always that easy? Like that is amazing.
We've put a tremendous amount of time and effort into making this as easy as possible, and that's really what we've said is for this to work nationwide, and we want this to be a tool in every athletic trainer's toolbox and every sports medicine, anybody that deals with musculoskeletal injuries, really, toolbox, to be able to use seamlessly, and like the individualized care that an athletic trainer is able to provide an elite athlete.
Right.
Some of this can allow that universally.
I'm blown away by it. Again, I'm kind of dumbfounded. It seems like it was right there. Again, you know what I mean? Like every good idea, it seems like it was right there. Like yeah, of course. Why wouldn't we be doing this?
Right.
But then it's always like who had the ingenuity and who had the creativity and the follow through to come up with it. What was the impetus for you to go down this road?
Great question. Yeah, our senior year, prior to senior year, really, we're tinkering with 3D technology, and Duke University, Duke Engineering's campus was home to one of the biggest farms of 3D printers in the country. So they're on the cutting edge of this research for all types of things. Duke Engineering School is right at the intersection of Duke Med School, of course, and then the main campus. So a lot of collaboration in existence there. But our senior year, we had approached our athletic trainers about this before. There might be some overlap here. And when our starting quarterback at the time, Daniel Jones, went down with a clavicle fracture, Hap Sars, or our head athletic trainer, said if there was ever a time to make a custom device, it would be with this athlete and this injury, because this is a hard one to protect with orthoplast, and we're really trying to get this guy back quickly. He's a top quarterback. We want to make a run at a bowl game. And Daniel returned in 3 weeks post-op from a clavicle fracture with the help of a support device. He had pain-free, full range of motion, which is impressive for his recovery time. And
Right.
obviously wish him the best right now recovering from an ACL. We don't make knee
For
braces,
sure.
which is a bummer.
Right.
But it was an incredible story. And right after that is, can you use that same technology to make a device for this injury and this injury and this injury? And when the answer continued to be yes, we were, well, there might be something here.
We're onto something. Yeah, let's try to
snowballed
run
from
with
there,
this.
right,
For
right.
sure. You know, and it actually brings up a question in my own mind to sort of take that to the next level. And I'm sure you guys have thought about this at some point. So right, you have an injury, so you create a brace to help protect that injury during that the recovery healing time. But what about using some of these things prophylactically, right? Like we see you're watching an NFL football game, and for the most part, still every lineman walks up to the line, and they all have these braces on their knee to protect their MCL and whatnot. What about some other types of injuries or other types of scenarios? If you can really make a low profile custom brace, is there a role potentially for that?
There absolutely is, and we're doing so right now with a couple devices, mainly being prophylactic thumb guards. We've outfitted the 2 deep offensive defensive line on some teams, and they're seeing UCL injuries, among other things, significantly reduce.
That's impressive.
Speaking of UCL,
Yeah, right.
we're speculating. We have no idea, but
So as with our typical setup of the show, we do talk current injuries, and today there was some news dropped about a running back from the Indianapolis Colts, Jonathan Taylor. Started the day with reports that his status was in question after a thumb injury from this past week.
right,
Against
local
the
guy, grew up
Buccaneers.
down the road,
Just down the road, Salem County, yeah. So he gets injured, and now it's all the speculation. And then a couple hours ago, I think on my way over, they were saying he's getting surgery now.
Right.
And I wanted to say, well, what kind of split can we make him to say he can play this weekend or whatever the case is? But here he's getting surgery. He's going to be out a couple of weeks. So we can speculate a little bit, but it sounds like from what Dr. Frey and I were talking a little bit, it sounds like probably like a UCL injury.
If I had to venture a guess,
yeah.
that's where I'm going.
Yeah.
So it's kind of the ligament that holds the thumb. Gives it some strength so it doesn't kind of bend away from the rest of the hand there.
Right.
And it's a kind of this notorious injury. And I actually almost don't want you to comment because I don't know if you have if you're going to have any role in his treatment, in his care, and then that creates up a whole nother issue. So yeah, steer clear of that. But
Right.
I feel like that's a perfect scenario to
Right.
help somebody to get back a little more quickly.
And I think we can even go down the road of like, if he wasn't getting the surgery, right? Like, and it was just something that you wanted to protect it, pun intended, right? Protect his hand in the situation. This would be a great case because it's a quick turnaround, you get it done.
Yeah.
And for him's position specific is that he's a running back, and I think it was reported it's on his dominant hand. So when he's holding that football, his thumb is pretty important to reduce fumbling and all that other stuff.
For sure, to get away, like you mentioned the name of the company.
Yeah.
Just so the people who are listening, there's a little bit of clarity there. It's a little bit of marketing, just genius, right? Like it's
Genius
actually
marketing.
protected as Protect3D, but it's Protected is the company.
Correct.
And using the 3D scan to do it, and that sort of purposeful ambiguity, just marketing genius. Yeah,
Thank you,
well
guys.
thought out.
Very well thought out for sure.
Yeah.
Been told we're too smart for our own good sometimes.
I mean,
Duke graduates or just you guys?
a little bit of both.
Little
Comes
bit
with
of
going
both.
to Duke for sure.
Right? No
Speak
joke.
to the tight-knit community. I think that's what athletic training really is.
Yeah.
And
Right.
It's awesome that you've been through the ringer. And I started the company with 2 of my football teammates. So we've kind of been through it together, and that's what kept us going. We started the company right before the pandemic, so I've been through it. I've tried to build something successful and here for the long term that it's really making a difference in people's lives. And now we've had the pleasure to hire a full-time team around us to keep growing this. And it really is an incredible why to come to work every day. And I think it's one that hits home with most athletic trainers too.
In a similar vein, and I'm sure you probably share a similar story. When I was trying to figure out what do I want to do in life, that was like a huge part of it, right? Like my goal wasn't to make the most money I could. If I did, I would go into business trying to make money. I wanted to be able to enjoy what I did, and I wanted to be able to help people. You get a lot of gratification out of helping people, and of course, this is a great idea and it's a great concept, and And hopefully, in the end, this will be this will be your career. This will be your life. But in reality, you can feel like really good about it because you're sort of changing things in a way that's helping people. You know what I mean? Like that's a fantastic thing to be able to do. To build. Hopefully, will be like a very nice life for yourself and do it. Not at the expense of somebody else, but to the benefit of somebody else. Like, and that was a huge part of this, at least for me, to go into medicine.
You hit the nail on the head there. I think every use case tells an individual story, and it's inspiring. We not always even have communication with the end user of our products, but sometimes we watch them on television make a big play, and we're like, oh, that guy may or may not be wearing a product. Like we're cheering for, well, that team wears 3D printed devices and that team doesn't. So go that.
Right.
Exactly.
And I mean, I think it's interesting that you get to make an impact on those certain things because, like you said, all the individual cases that you can help. Like, you've probably sent a 3D printed supportive device to someone who probably without your device couldn't play in their last game of their senior season, or the last game with their their teammates who are graduating, or to make that big playoff run or something like that. I mean, and those things kind of make a difference, and that's can't beat that.
And then on like even a grander level, right? Like so be able to get back for that part of the season and that part of their career where they needed to make an impression on a scout, or for the fan who's rooting for that team to, although you might be on the other side and you lose to the guy that happens to be back thanks to you. Yeah.
It's inspiring every day. We had maybe a year or so ago, it was a high school athlete coming back from a clavicle fracture, and this is back to the origin story of Daniel Jones coming back from a clavicle fracture, but high school lacrosse player got to play on his senior night, and this was the last game his dad ever came and watched him play. He was, I think, unfortunately passed away not a month later, and this was a gut-wrenching story, and got to be on the field and watch him score 3 goals on senior night. And to be involved in something like that is just incredible.
And for some people, they're like, so what? But for someone who like that's
big.
That's big, right? For someone like I'm sure that dad helped that kid, helped that player get to where he was, and to be able to, I mean, that's tremendous. Yeah.
And I can relate to that because I get similar things, right? Like similar thing, you get that person with an ankle sprain back really quick so they can play in that game or whatever the case is. But I mean, my reach is only within the student athletes and the people I work with directly at my one job. You have a national outreach where you can touch a little bit of everybody, a little bit everywhere,
right?
And make
amazing
a big difference nationally, which is crazy.
You hear a story like that and you don't understand what goes into it, and and relating it back to Frank, like Frank shared, right? A couple episodes ago, Frank opened up. Frank Price, is one of the brewers and one of the owners here neck of the woods, about why the beer, which I was drinking when you got here, the Meet Your Maker beer, which is one of my favorite beers of all time. But like he opened up, why is it called Meet Your Maker? And he went through he almost died, he was a Cooper, and all this other stuff. It's great to hear kind of the stories behind the story. It really is. It always is. The changing gears a little bit, what's that tall guy over there in the corner?
That is a foot and ankle device. It's an ankle foot orthotic for drop foot, similar pathologies. But this year, 2023, marks the launch of the protected solution in the clinical space. So this is the first year we're doing the 3D scanning just on an iPhone mobile device.
Right.
It is really expanding the reach nationally for all of our products, and that type of solution, that type of impact can now just be felt all over the country. Is really incredible. But as we've launched into the clinical world with the foot and ankle space, some orthopedic clinics now offering this device for their patient population. We're seeing people that have worn braces for years wear our device, which has similar benefits to why it's helping elite athletes get back on the field. It's low profile, it's lightweight, anatomically precise, so you don't notice you're wearing the additional protective equipment, and you can get back to your daily life, your highest level of play for our elite athletes. But really getting back to just walking again. We put a device on a patient this past month and took 3 steps in it, their eyes lit up and said, I'm going to be able to walk again. I'm going to be able to keep up with my kids. I already know it. And it took
life-changing
a split second. And it's game-changing outcomes on the NFL field. life-changing outcomes for the general patient population.
From an orthopedic standpoint, right? It's artistry for the guys that are able to make these things, and they do it by hand, and it's pretty amazing. But they are often, we hear the complaint, it's a little bit too bulky, it's a little bit frustrating, and some people actually opt to go, without it because they find the brace to be just, especially off-the-shelf brace, right? To just not be adequate.
Right.
So to be able to give that person kind of their life back and be able to do some of the things that they didn't think they were going to be able to do, that's pretty extraordinary.
Thank you. Yeah, I heard it the other day, and it's a simple statement, but it kind of starts and ends here. The best brace is the one that you're going to wear.
Right.
Yeah.
Right. For sure. Right.
That makes sense, right? Like, I couldn't tell you how many times I try a brace with a student athlete. Like, all right, try that out of practice. Dude, that sucked.
Yeah.
Okay, let's try this other one we got.
There's no way I'm wearing this.
Yeah, no way. All right, we'll try taping. Yeah, that didn't work either. All right, we're going to keep trying until we find something that works.
Right.
But again, it's all stuff that's, you can say kind of a little bit like taping's more custom fit because it's like laid on directly on the skin versus like, off the shelf brace or whatever the case is.
Yeah.
And even with like the AFO setup is, I worked in an orthotics department in a orthopedic setting.
Heck yeah.
And even the turnaround time for that stuff is just like, it takes a while. Then you got to have it
a
come
while.
in, try it on, do this.
Send it back.
This doesn't feel right. This part's too tight. All right, and send it back. And then
Right.
another couple weeks come in, and it's still like, from time of when we fitted them to the time they actually get something comfortable wearing them, it's like what, a month, 2 months,
Right.
like
It can be a process.
Yeah.
It can be a process. Sometimes it's not, but it can certainly be a
Right.
process.
sometimes they fit perfect. Yeah, sometimes it works, but sometimes it surely doesn't.
All right, so I want to try to connect the dots here. Like we've been talking about the products, and let's say someone who's listening, they're interested, or you have an athletic trainer, in a high school or in a college or in a different setting, and they're interested in making this one of the tools in their toolbox. Like how do you connect the dots here? What
how do we get
happens in
started
between?
here?
How do we get started?
Yeah.
Right.
We're trying to make that as simple as possible. So our app is available on the App Store. You download the Protected app and you sign up for an account. You put in your athletic training certification. So
Sure.
we're providing this for athletic trainers. We want it to be a tool in every athletic trainer's toolbox. And we'll go through an approval process. We'll do a 3D scanning training. So we'll onboard you for how to do the 3D scans.
Right.
Once you do it a couple times, I promise. It's as easy as taking a video with your smartphone.
Is as easy as you just made it look? Yeah.
It is.
Yeah, right. And that's with a bunch of equipment in the way and after a beer or so. So that's pretty impressive, right?
Yeah. That's part of the equation, man. When you come on the show, that's what you do.
Exactly.
You have a beer.
Well, I didn't take a minute to mention Neck of the Woods Brewing. I've heard you guys talk about it, but this place is the real deal.
Yeah.
Yeah.
Agreed.
These IPAs are great. The sours are great.
Yeah. It's pretty good stuff. It's pretty good stuff.
We're spoiled.
I know. It is. Yeah. We're lucky. Yeah.
So again, the athletic trainer, download the app. We would grant immediately have access to some of our products. On like the clinical side, it is like an implementation maybe in the DME department to be able to do the 3D scans.
Right.
Clinical staff can do 3D scans. And that workflow, similarly to the high-paced athletic training room, to fit right in, to save time.
Right.
Very similar process.
I know. I think it's very cool. I actually tried to talk. We've had Dr. Bernardini on the show a bunch of times,
Right.
and I was going to try to have him down here tonight as well. He was he's hanging Christmas lights with his kids, and I said, "You just go do that, buddy.
You gotta do that,
Yeah.
absolutely.
No. There are some things that are important, and you don't miss it.
Correct.
But I'm hopeful that we're going to be able to have access to your products.
Yeah, for sure.
But it's in the works. We'll see where that goes. Yeah.
It usually takes like one use case for somebody, one successful use case for a medical group or medical staff to say, wow, this is a game changer. So we had one this year, the third metacarpal fracture. How do you usually protect that? Maybe clamshell, maybe cast, got to splint the knuckles, got to splint the whole wrist. So we have a fully encapsulating club that's, again, low profile, lightweight, immobilization device. Ultimately, delivering the device, we're always like, well, I hope that works well. Not only did it work well, the linebacker that was wearing this had an interception
There you go.
with this device.
And it works out.
Can't beat that.
So when you call it a club, what I picture in my head is this big, bulky device. What can you establish a little bit of what a club actually is when you refer to it as a club?
Yeah, for any of our products, it's the lightweight, low-profile version of whatever comes into your mind.
Right.
Yeah.
And it's like reinventing the splinting and bracing.
Right, because like the base of it, this is all similar in essence of like what orthoplast or a casting material would, and like for regulation football standards, you still have to cover it with the high density foam and cover it completely. But what's underneath of it, I think, is what makes the difference in that like it's this versus something very bulky or like not 100% within a millimeter anatomically correct, and you have those spots that pinch or whatever the case is. And then I've had it where you take the club off of somebody and they got this wicked blister
The
over
big
here
blister.
from whatever
Yeah,
the
yeah,
case,
yeah,
you know.
of course, yeah.
And I think that kind of stuff is like, that's, you know, where it really makes an impact
Yeah, yeah.
and changes it up a little bit.
Yeah, really cool stuff. Do you know what Blender is? the online.
The CAD like design platform.
Yeah. Of course you do. Yeah. So I've been blown away by this. Like, so my son. Yeah, again, here I go off on the tangent. Come home. My son's kind of into photography. Actually, afterwards, I'll show you some of his photos. And I come home one day and there's a picture of a donut on the computer screen. And I'm like, he's like, you like my donut? I'm like, yeah, it looks great. And he's like, it's not real. And I was, again, I'm the old dude, right? I have no idea what's going on. What do you mean it's not real? Like shadowing and everything's perfect. He's like, oh, I made it. So he's done the same thing. He's then taken it, like made this perfect donut. And then next thing you know, I actually have a medical device. I'm like, can you make this? An hour later, 3D printed, here you go. It is
awesome.
mind-blowing where this stuff can go. And
Do
so
you have
Blender is the one that he used.
Do you have a 3D printer at home, Dr. Fred?
I do, of course I do. Yeah.
That's awesome.
Because because of him, he's fantastic, and I gotta encourage this. This is where the world is going, as far as I know.
So you can take that a step further and like, where could our technology be going in the future? You might be able to do 3D scans for some splinting, bracing, common like devices that you may not need to go to the doctor for. You could 3D scan somebody
You're
at
wrong.
home. I'm wrong, or
No, I think you could.
yeah.
Definitely could, right?
But until we get there, I'm just gonna call you.
Yes,
absolutely.
please.
Yeah, I'm definitely going to reach out to you
All
before I
of
try.
our devices should be prescribed at the direction of their medical professional.
That's right.
Right. Disclaimer there with that one, right?
Absolutely.
For
But
sure.
the digital model, could it be printed at home? Could it be 3D printed in the clinical setting? And
Yeah.
there are a lot of opportunities.
Pretty wild.
Yeah, that's really crazy. Just ease of access and everything. And I think we touched on all the devices. No, we didn't touch about this little guy here.
What is that?
What's this one?
That would be like a metacarpal fracture. So if you start with a club, you can transition to lower and lower profile device as you
Right.
go on. So this was a second MCP dislocation device and just the lowest profile clamshell that
Yeah.
is going to prevent hyperextension and provide the right level of support here.
So it's this little thing, right? Like where before we were using the splints that kind of up your wrist, up your forearm, holding in the right position, and now it's that little
Right.
guy.
And that tiny little thing can be a huge difference maker
Oh, yeah.
for
sure.
a guy getting back on the field and feeling confident.
You know, there's you guys you have a few YouTube videos and testimonials out, describing some of your products, and one of the YouTube videos is Dr. Ellington, right, a foot and ankle specialist. The first thing I have to say, I love what he said at the very beginning. I don't know if you remember this or not, but I pay attention to this stuff. So I went to med school at Georgetown, and one of the things, and the orthopedic world was like ortho was a huge thing in Georgetown. It's part of the Georgetown experience. Everyone does their ortho rotation, which is not very common in most medical schools. And one of the things they pounded into us is take pride in getting people better without surgery. And that's actually the way he had started his little testimonial, like, yeah, I'm an orthopedic surgeon, but we really try to get people better without surgery. And the fact that these things are going to help people do that, the fact that this is going to help people potentially get past some of these issues where maybe we're going down the road of a surgery. I don't know. I think it's invaluable. I think it's a great product. I think these are great products.
Yeah, he said the splinting and bracing solution, this is the first time a patient has ever told him, you've changed my life, and that it hasn't been the result of cutting them, of
Right.
performing surgery.
Right. Yeah. And don't get me wrong, I'm a surgeon, right? There are times when you have to do surgery.
Right.
That's your best option, your best chance at a good result. But at the same time, if you can increase your chances of getting better without that, yeah, of course, every time.
Right.
That don't absorb the risk of surgery if you don't have to.
I think that's a mild misconception. Everyone thinks a surgeon wants to cut you open every time. It's like, I work with plenty of them, and I don't think that's the case.
Yeah, I think you're 100% right. And sometimes you have difficulty like convincing someone like no, I'm looking out for your best interest. I don't. Yeah.
Hey, I get it too. I mean, everyone thinks an athletic trainer is going to keep you out from playing. So
Right.
they
That's-
avoid
they
us
all
like the
look-
plague.
yeah,
they
they
don't want to
dodge
come
you.
see us at all. It's like, no. I can help you stay in healthy and not make you get worse or whatever the case is.
That's right. It makes me happy if I can keep you out there.
Right.
That's why I'm here.
My job is to
That's
see
the
you
goal.
out there every time. And that's the best part about my job, to get you back out there.
For sure. Right. Also, I don't want you to hurt yourself. So.
Right. Don't want to put yourself in harm's way either.
The second I left collegiate athletics, it was when I appreciated athletic trainers the most. It's like, wow, I don't have access to this level of healthcare anymore.
Right.
Changes, huh? You thought everybody had it.
Sure
Yeah.
does.
It is a different, and it's funny. My previous job, we used to have interns or students shadow us, and they used to give us these questions like they had before class. And unfortunately, it was always the same 7 questions, and I just eventually just typed my answers out. And the last question was always like, what makes athletic trainers so different? And I was like, we're one of the only healthcare professionals that see our patients every single day.
It's true.
We see them every single day, and we modify their care based off how they're feeling, whatever the case is. Outside of someone who's living in an assisted living home or something, or at the hospital, they get seen every single day. Like, we're up there with every single day. You're coming in to see us.
And I will tell you that the perspective you're able to gain about a person because of that is immensely helpful in terms of figuring out what is the best treatment route and treatment algorithm. Because if you see someone once every 2 weeks, once every 3 weeks, and you get this little spot picture, you don't know the person quite as well. And a lot of that goes into it. Like, is this person going to be more reliable? Is this person going to be less reliable? What is their personality? Like, it makes a huge difference. Yeah, for sure. Yeah.
The more we've worked with physicians, Dr. Frey, the more we've appreciated the collaboration with athletic trainers. And it is the trust you can have of the continuum of care. Obviously, at the elite sports level, they see their patient every day, and that individualized treatment is essential. But it's awesome to see when that can work in general practice as well.
For sure.
Yeah.
Yeah. No, and I think you're 100% right, and I don't think the average individual, the regular population, truly understands that.
I would agree.
I got to tell you, man, I really appreciate you're coming up from Durham to join us for this show, and that's a heck of a long way to come, and I really appreciate you coming on and being able to show us and explain some of this stuff. It's very, very cool stuff that clearly I think is going to be game-changing. There's a few different things that I think out there that are sort of developing right now that could change the things, but I don't. There's few things that I think that are going to be more game-changing than what you guys are doing right now.
Couldn't thank you enough.
Sure, absolutely. Man.
So I think we're good here, gentlemen. And before we go ahead and close out our tab, we want to give a shout out to our sponsors like we always do. The Energy Lab, the region's premier sports performance center and destination. Neck of the Woods Brewing Company, serving us up these great beers all night long. And Timber Rear Productions, helping us put together this show for all of our listeners out there and our fans. We appreciate you like we always do. Have a great time, and also stay safe for the holidays. With that being said, with the holiday season coming up, there might be a little dip in our production of shows because Dr. Frey and I are
life gets in the way.
Life gets in the way a little bit, but we will be back shortly. And if not, have a safe holiday season for everyone, and we'll be back soon. Appreciate you all.